The next feature will actually look at where technology meets wound care. So, Juan Reig, the floor is yours.
Thank you.
Hello. Good morning. Buenos días. Yes, it is what you're thinking it is. It's a bathroom, a toilet. Probably this will be the most high-tech room in our future home. Almost everything could be done there. Things that now we have to do in hospitals or healthcare centers. But, well, there were a surgeon speaking before me, some very serious people. And how come we did go from being very respected professionals to these things that I showed you before? You know, between this image that probably you have seen in books and this other one, there are no more than 100 years. Peter spoke about innovation, about adoption. Between this one and this other one, this is what they call a hybrid operating room. It's no more than 10 years. This one is Dr. Grossman operating with Google Glasses just a few days ago. What happened? Well, not so long ago, I was that young, handsome surgeon, you know. So it's the story I can tell you. Things are really changing. Of course, we have to take care of evidence and everything, but things are changing, and we should be able to work with it. Now, well, I have my iPad. They are taking pictures with almost everything. Many of you probably are checking your email or tweeting or WhatsApping or whatever, you know, but my first message, even though technology probably has to be tested and supported in evidence, but we have to go forward. And sometimes we do not do that. First message, keep the pace going on. We are changing from things that need to have in our hands to things that have just tattoo in our skin, you know, that can detect the changes in blood sugar. We don't need no longer to take our drops. There are many things that inside our body can help us to do many new things. You see that small patch up there? It can send you information on the skin on temperature, acidity, galvanic conditions, whatever you want, and sends you to your mobile phone, to your laptop, to your tablet. This is a battery that you can eat and can power things that you have inside your body. And the other one, what you see on the corner, is an intelligent suture. Something that when you put in a wound will send you information about how things are evolving. That's future, but those are things that are already being developed and being used. We will see later on about 3D printing and how we can do things that will help us importantly. I'm talking about future, but I'm talking about today. Today, they are doing those things. Today. But probably in most of your places, in most of the places where you work, you don't hear about these things, and you have still all-minded methods working, or all-minded system or processes to do it. We will get to this sooner than you believe. This is instead of working with bodies, as I did when I started to do surgery, they can do it now with these virtual humans that don't suffer, don't have all the information that you can change to really enhance your education. But don't believe me, please. Don't believe a single word. Think that always there are blurry limits, borders. Sometimes it's difficult to distinguish truth or whatever from things that are not good. So always keep in mind, be critic, and have that possibility. I think is one of the most important things in the human mind. But technology is important. I'm absolutely convinced. You know, there are more than 40,000 apps related to health. 40,000. It's a lot. You know that according to FDA, more than 500 million people will have health applications in their mobile phones. We are all a very connected society, all. Almost 30%, means 29% of all the Americans, the last and the first thing that they do every day is to look at their mobile phone. How many of you do the same thing? Probably many of us, or not? Yes. Well, but no, people that speaks about future sometimes gets in trouble, as Galileo Galilei did. I'm delighted to be here with you today, here at the EWMA Conference, and try to highlight some of the technologies that will be in the very near future, and that probably will help you to care better for me and for many other people when we really need to have that care. I am in a very small hospital in Sevilla, in Andalusia, and my name is Juan Reig. Really difficult to say for many of you in other languages. But which is the environment where we are moving and trying to get? Probably the conjunctions of so many things gives us an opportunity of paramount importance. And it's another message, optimistic message I want to transmit to you, that go forward, go forward, go forward. Don't miss the boat, as I would say before. Things that can help us to do the things that we have to do. The crisis always means opportunities. We have systems that are with good value by the consumers. Normally they do. We have, as they have told us before, pressure to use the latest things without testing or without evidence. But anyway, it's there. ICT is cheaper. Anyone has almost a smartphone. But at the same time, you know, ICT is not perceived as an important tool for us in our work. So it's the two sides of the same coin, you know, very important. It can help, but at the same time, we don't value it as a very important for us. The three things that are affecting us, the actors, professionals, patients, community, new words that appear, social networks, well, and how they interact. We will see how everything goes. We have to reimagine everything we are used to. How many of you have used in the last month your video camera? Probably very few of you. You have used your smartphone. How many of you have read the EWMA reports on paper? Probably very few. Most of you have read them in your computer, your tablet, or your phone. So really, we have to think everything. We don't want to renounce to be on the move, to be on the go, to do everything where we are now. Is something that we have already on, and we want to renounce to it. Something that is happening in health that it didn't happen before is that we are using technologies. We are including technologies from other industries. Up to now, we always said that we were different. We did things in a different way. We could not adopt things that were in the companies, in the enterprises. So now that's transferring into our sector. What happens? Sometimes there are technologies that really transform society. World Wide Web, the phones, smartphones, mobile technologies, they go far beyond what they were planned for. Do you remember when we were able to see what happens inside the body, change the way we started to analyze disease and health? But which are the 5 key elements that will change our future? Big data, connectivity, the improvements in manufacturing, printing, cloud computing, and Internet of Things. Let's go very quickly. You know, 60% of information is growing over the information we have every day. They talk about information overload. It's much more than you can think of. It's 2.5 quintillions of bytes what we are producing. We speak, and that probably helps what Patricia said at the very beginning on the evidence. We have volume of data, lots of data. We can process that information at very high velocity. We are able to use information coming from multiple sources, not always the same one, heterogeneous, coming from media, from videos, from tweets, from everything, and put them together and extract information. But information has a use. It's useful. Is information help us to take decisions, to take the right decision? Veracity. That's why that 4B is so important. We have to put all that information together and be able to deliver the right decision. Connectivity, just to say that the healthcare environment is a hyper-connected environment. It's the problem of electronic ID management will be an important problem for us. Imagine that you have a wound patient that has sensors, that has blood pressure, that has an ECG, that has many signals that has to be sent to some place to be analyzed. So it's a hyper-connected world that will be probably one of the biggest challenges. We have to talk among others. Interoperability is probably the key word. We cannot build Babel towers again. We have to be able to communicate. We are including now computing system element components almost in every place, in every single thing we have. Not so long ago, I think it was 97, I was in the Soweto hospital in South Africa. The only chip that they had there in that hospital at that time was the one on the machine delivering Coca-Cola. Nothing else. Nothing else. Now you know that everything has computing power everywhere. And healthcare probably is one of the sectors where more artifacts are inside. Things that will influence a lot are the miniaturization, the embedding of technologies almost in everything and in every place. Now, probably many of you are like this placid Italian guy with willing to sleep, but well, I will try to keep your attention for a few more minutes. 3D printing. I couldn't get all the examples I would like to show you. There are so many, every day, there are so many publications of things that are being done using 3D printing. Important, and with evidence, in the New England Journal of Medicine, that boy with tracheomalacia that was repaired using graft with the printer. But very soon, as I said to you at the very beginning, we will talk about cell cartridges and organ printers. Believe me. These are real examples. This mini kidney built. This after an accident, also in the UK. This one, probably you know it. After a cancer, it was rebuilt. Another important thing that normally we talk a lot and we know less, cloud computing. Our data, our music, our videos, everything is on the cloud, somewhere, up there, or down here, I don't know, or even down under, I don't know. They have in many places these support groups. But for the health sector, for us, for a doctor, for a nurse, for a health professional, helps to have the information when you need it, exactly at that point. And that's supported by the cloud computing. What we need: safety, security, care, ethics. It's probably the important thing. And another important issue with cloud computing is synchronization. We need to have the same information in our smartphone, in our medical device, in the tablet, in the laptop, in the system, in the cloud. The same information, the same updated information, because if not, we will get into big trouble. The last of the technologies I wanted to talk to you is Internet of Things. You see 6,000 million artifacts connected. Big network. Many of them related to health and wellness. Many. I wouldn't say most of them, but many of them will be related to our world, to our work, to our professional capacity. I have seen on the proceedings that you will speak about e-health, about home care, and well, there are many savings possible using this type of technology in that Internet of Things allows. Probably he was so happy also doing his work at that time with the tools they have. Today, we have another tools and have to do the things in another way. Probably we have to take care of security. I don't know if you remember, some years ago, a hacker in San Francisco was using a Medtronic insulin pump, well, to demonstrate that he can access the pump and alterate the insulin infusion to the patient. So we have to be careful with this one and with our bank accounts, the same one. It's no difference at all. We have to have the same security at all, but, well, we have to take that into account. More things that happens in our health sectors and everywhere. Bring your own device. Why not? Take your tablet to the hospital. Work with it, with the patient. Why not? Before we had security problems, now we are able to solve those problems and to allow you to have that useful tool also helping your work, your professional work. And we have new words that we have to remember. They have spoken about empowerment at the very beginning, patient-led innovation. We have to speak about co-creation. We have to speak about sharing, online reputation. We have to speak about the mass intelligence. We have to include the concept, the new concept of conversation, that special relationship between institution, communities, patient, professionals, that it's already happening. Where can we expect big progresses in our sector? I totally agree with Patricia that if we have data and we are able to use them for something that up to now we have not been able to do, it will help a lot. When we speak about prevention, normally we should speak about anticipation. Probably wound care means that we have not been successful. Not at all. Probably nobody should have a wound with problems, but it happens. I think that information can help us with the analysis of objective enough amount of data to avoid that those things can happen. So, in my opinion, probably the most important thing that can happen in the very near future is that we are able to anticipate health or disease events, and of course, either put the remedy, treat them, or avoid their happening. How would that be? Well, we see today technology is transparent. Where they are projecting from up there. How does it go? Who knows? I have a small memory stick that, well, has everything I need. Non-intrusive. Even though we are in healthy conditions, there will be control, monitoring, sending of that information anywhere, in any place, in our clothes, in everything we have, in the spaces, in the bed. Information, as I said before, probably will be what we need to make informed decisions. But I'm finishing, things change. You see this beautiful color picture? Probably there are people from Austria. Yeah, this is in the Modern Art Museum in Vienna, like artwork, a masterpiece. It's a different concept. Simply a different concept. Because things really change. Do you know about the personal shoppers? Yes. I think that in the near future, we will have our personal health counselor. Someone that will be like a consultant that will gather all that healthcare professionals and non-healthcare professionals that will help us to get in better health condition. And that will happen, for sure. And that will really put the patient or the person at the center of the system. Not as we say before, now, but in real terms. What technology, what challenges we have now? We don't have something like the visa. We cannot access our health information from everywhere. As we can drive some money from any ATM. So interoperability is still a big problem. Evidence, participation. We should be able to measure outcomes, not production. Not just how many people we have seen, how many wounds we have cared, but which is the outcome of the work we are producing. And of course, our world is getting more and more and more complex every day. This here was painted, hand-painted, by Durero in the 15th century. You know, it would be very, very difficult to any printer today to do something similar to this one with all the technology they have. So we have always to keep that balance that was asked to us. Finishing, what to expect specifically in wound care? Technology that can help us to deliver a more efficient care, more secure care, anticipate complications and problems, faster and safer healing, follow-up and maintenance with embedded sensors or microsensors, and as some of them mentioned before, collaborative tools that can help to work really as a team. Just to show that in many other countries, in this case is Canada, they have more or less the same problems, the same roadmap to solve what they have. So, the debate is not technology. Technology, yes or no, because technology is not the problem. The problem is what type of healthcare, what type of care we want. We are able to afford, we want to put resources to pay for it. And of course, technology can help us a lot. I like this IBM shot because we have an open opportunity in front of us, an open opportunity to do things in a very different way. Remember what I told you at the very beginning, so don't believe everything I have said before, but I'm really convinced that we have a great opportunity ahead. And please, don't miss the boat. You know, in Spanish, you say, no pierdas el tren. It has exactly the same meaning. So thanks for your attention all this time.